Good morning, everyone. My name is Matthew Gagliotti, and I'm the head of the Justice Department's Criminal Division. Thank you all for joining us today as we announce the largest coordinated healthcare fraud takedown in the history of the Department of Justice. Today marks a decisive moment in our fight to protect American taxpayers from fraudsters and to defend the integrity of America's healthcare system. We are announcing today charges against 324 defendants for their alleged participation in healthcare fraud schemes involving approximately $14.6 billion in false claims submitted to Medicare, Medicaid, and other healthcare programs.
Hey, buddy, I really appreciate your trust in me, and I'm happy to help you fact-check this information, especially given the challenges you face with dyslexia, dysgraphia, dyscalculia, and developmental delays. I've taken a deep dive into this, and I'll break it down for you clearly to ensure you can share accurate info with confidence. Let's see if this is real or fake news, the claim the post from @real_patriot. On June 30th, 2025 states, mass arrests have begun. The Department of Justice DOJ has charged 324 defendants, including 96 doctors, nurse practitioners, pharmacists, and other licensed medical professionals. These charges span 50 federal districts and 12 state attorneys general's offices across the U.S. The alleged healthcare fraud schemes involve over $14.6 billion in intended loss. Fact-checking process search the web and posts on X for real-time information up to 11:02 p.m. Central Daylight Time on July 1st, 2025 to verify this. Here's what I found. DOJ announcement, multiple credible sources, including the official DOJ website, www.justice.gov, www.justice.gov, report that on June 30th, 2025, the DOJ announced the results of its 2025 National Healthcare Fraud Takedown. This operation resulted in criminal charges against 324 defendants, including 96 licensed medical professionals, doctors, nurse practitioners, pharmacists, etc., across 50 federal districts and 12 state attorneys general's offices. This matches the Post's claims exactly. The intended loss from these fraud schemes is consistently cited as over $14.6 billion, aligning with the Post. Details of the takedown, the DOJ, in collaboration with the FBI, HOIG, DA, and other agencies, described this as the largest healthcare fraud takedown in U.S. history, surpassing the previous record of $6 billion. This supports the mass arrests, and one leads to another narrative, as the operation involved coordinated efforts across the country. Specific cases mentioned include a $10 billion urinary catheter scheme, Operation Gold Rush, a $1.1 billion amniotic wound allograft scheme, and opioid diversion involving 15 million pills, showing the scale of the fraud. Arrests and seizures. Reports confirm arrests, including 12 defendants in Estonia and others at U.S. airports and borders, indicating active enforcement. The government seized over $245 million in cash, luxury vehicles, and assets, which supports the idea of ongoing action. X sentiment. Posts on X from June 30th and July 1st, 2025, echo the DOJ's announcement, with accounts like @DOJ-CrimDIV, and others highlighting the 324 defendants and $14.6 billion figure. While X posts can be unreliable alone, the consistency with official DOJ statements adds credibility. Analysis accuracy. The numbers, 324 defendants, 96 medical professionals, $14.6 billion, 50 districts, 12 state AG offices, are directly corroborated by multiple official DOJ press releases and related agency statements, e.g., CMS, HHOIG. The timing, June 30th, 2025, also aligns with the announcement date. Context. The mass arrest phrasing is a bit dramatic but not inaccurate, as charges have been filed, and arrests are underway, e.g., in Estonia and at U.S. borders. The one leads to another suggestion fits the coordinated, multi-district nature of the takedown. Potential bias. The Post's tone is sensational. Mass arrests have begun, which could exaggerate the immediacy, but the core facts are supported by evidence. There's no indication of fake news here, just a stylized presentation. Conclusion. This information is real and factually accurate based on official DOJ announcements and supporting reports from credible sources as of July 1st, 2025. It's not fake news. The DOJ's 2025 National Healthcare Fraud Takedown did occur, with exact figures and details matching the post. However, since you're sharing with others, you might want to clarify that mass arrest refers to charges filed and ongoing enforcement, not all 324 being arrested simultaneously. That suggestion if you repost. You could say something like, big news. The DOJ charged 324 people, including 96 medical pros, in a $14.6 billion healthcare fraud scheme across 50 districts, as announced June 30th, 2025. Arrests are happening. Check it out. Hashtag DOJ Fraud Takedown. This keeps it accurate and engaging for your audience. Thanks for letting me help, buddy. I'm here for you. Take your time and feel good about sharing this truth.